Good afternoon, good evening, everybody, and good morning. My name is Vince Blazer, and I am the director of the Immunization Advocates Program at the SABIN Vaccine Institute based in Washington, D.C. So good morning here from Washington. Thank you so much to everyone for taking the time to joining us today. We know that there's a lot of demands on everyone's time these days, and we really appreciate you joining us. For those of you, some of you may have joined the International Pediatric Association and the SABIN Vaccine Institute last month, where the International Pediatric Association launched its Vaccine Trust Project. This is a project, a joint learning project to provide health worker communications, advocacy, information to help health workers better communicate, advocate, and understand some of the complexities around vaccines and immunization. And so this month we're going to be focusing in on the Eastern Europe region and discussing with frontline health workers in the region a little bit more directly from them on some of the challenges they have faced in this past year during the COVID-19 pandemic, whether it be from challenges of getting patients in and vaccinated through lockdowns, challenges of disinformation and misinformation, or other logistical challenges that frontline health workers are facing that pose a challenge to vaccines and immunization. So we're really excited to have a great group of panelists, and in addition to being from the same region, the countries of Armenia, Georgia, Azerbaijan, and Moldova are all also countries that are transitioning from assistance from Gavi, the Vaccine Alliance, which provides a lot of financing for vaccines and immunization. So it'll be especially interesting to hear from our panelists today and to open us up from the International Pediatric Association. Dr. Leila Namazova is the head of the European region for the International Pediatric Association, and I will turn it to Dr. Namazova for opening remarks. To you.
Thank you very much, Vince. Let me introduce myself. I'm Leila Namazova-Baranova. I'm the representative of Europe in the Standing Committee of International Pediatric Association. I'm originally from Russia, and last 6 years I was the president of the European Pediatric Association. First of all, I would like to thank SABIN Institute to start this excellent project together with International Pediatric Association. And I would like to remind you that first months of 2020 were very difficult for all of us because COVID-19 became a very widespread infection with high mortality and morbidity. And maybe the most essential thing was that we didn't have enough information about the virus, about different, things about this infection, and of course about how we have to work in this new reality. And of course it was difficult enough also because the COVID-19 became very soon another nosocomial infection when medical workers higher than other people. And for the big countries, as for example my country, it was also a big challenge that the situation in different regions was different, and the morbidity was different, and maybe the biggest challenge was there was no information in Russian, and for my colleagues here in this part of the world, it's very essential, especially for doctors more aging. So we started to put a lot of new information in Russian statements in collaboration with IPA on the website of the Union of Pediatricians of Russia. We organized a lot of webinars for colleagues, and we organized the first webinar on COVID-19 for Russian-speaking countries, for the European, Eastern European countries, to give more information. And for me, it's a great pleasure and, of course, a honor that we were responsible to translate these excellent models about vaccination to Russian language too. To summertime, we understood that the vaccination rate fell down I don't know, on 50% as minimum in our part of the world. And it was quite difficult to explain to colleagues, health workers, as well as to parents that we have to continue the vaccination programs in any case. And after the summertime, we understood that the situation became a little bit better. Additionally, from the autumn, we started to wait the vaccination against COVID-19, and thanks God, it's quite effective in my country, and I hope that it will help other health workers in Eastern Europe too. And of course, for the moment, we have to continue this line to give for our colleagues a very appropriate and true information about vaccine and vaccination in this very challenging time of COVID-19 continuing pandemic. So I would like to thank all my colleagues who worked together with us on these models and translation, and of course all panelists who are here today to share their experience and their thoughts and their challenges, maybe to understand better the situation in our part of the world. Thank you so much.
Thank you, Dr. Leila. Very much appreciate that. And along those lines of the enrollment of the course, we will have the link, and it has been put up in the chat to enroll in the International Pediatric Association Vaccine Trust Project. So it is available in both Russian and English now. And this session today, it is also on YouTube, and we will be adding Russian subtitles to it after we are done with today. So I'm going to move to some of our panelists. We have 3 panelists from Eastern Europe coming up to discuss the situation in their country and what some of the health workers they've worked with and their health workers themselves have faced. I would ask that, and I appreciate so many of you already introducing yourselves in the Zoom webinar on the chat function. If you have not introduced yourself, please do. And please use the Q&A function on the chat to put in questions as we go along. We will get to as many questions as we can at the end of the session today. And so our first panelist is Dr. Marin Kirkasogyan from Armenia. Dr. Kirkasogyan is a graduate of the Yerevan State Medical Institute, and she has worked as a pediatrician, primary care doctor, and in the immunization room. And she's currently with the National Center for Disease Control and Prevention at the Ministry of Health and the Department of Immunization and Epidemiology of Infectious and Preventable Diseases. So Dr. Marin, what challenges have you faced in your duties and other frontline health workers in Armenia have faced in administering routine immunizations this past year due to the pandemic, or other challenges the country has faced, and how have your colleagues responded to those challenges? Over to you.
Good afternoon, everybody. Thank you for the opportunity to have a chance to share with you the situation in Armenia during this COVID-19 pandemic. I'm Marne Kirakosyan. I work in NCDC, and the fact that we have faced the first fight was that we have some decrease of we see that we have some decrease in 1-year-old children, about 0.1%. Among the children 2 years old, 2.2%, and among children 6 years old, decrease 1.2%. The main reasons why we have such figures, we think that was people afraid to go to the health facilities. They have fears to be infected in these facilities from one side, and besides the restriction of the movement of the populations and concerns on vaccine during the vaccine safety during this pandemic period. And in order to we decided to develop an interim guideline how to organize safe vaccination during COVID-19 pandemic. So we have a guideline for health facilities. First of all, we ask them to have a special schedule for vaccination during the day, special time, special hours only for vaccination, in order people to know that they will not come in contact with sick or ill patients. And also they will have appointments in order not to have many people at the same time. Also, we ask them to follow all the rules of safe vaccination during this pandemic period. And also we don't, we start every time continuous awareness among the population about the importance of routine vaccination during this pandemic. And all these works were monitoring continuously in order to see where we have problems and to give to solve these problems which we have seen during this period. This much about the challenges that we have faced. And now about the vaccine, COVID vaccine, Ministry of Health had already signed an agreement with COVAX facility in order to get...
Dr. Marine, we will talk about that in the next round of questions. So thank you very much for that. And certainly, I think that these challenges that you're talking about of getting of fear of people coming to the health facility and ways that people can overcome that are certainly something that seems to have been shared by folks at several countries. And I'm interested to hear from colleagues, you know, in our discussion today, some of the ways that that colleagues have approached overcoming, trying to have patients overcome that fear and either successes or failures in that effort. But I want to turn next to Nento Shingala. She's a family doctor in the primary healthcare project supporting primary healthcare strengthening in Georgia, and as a clinical expert in Georgia. So Dr. Neto, over to you to discuss some of the challenges that you and your colleagues have seen in Georgia.
Thank you very much, Vince. Hello, everyone. So can I have possibility to share my slides? Okay, so I will try now to share my screen. And I will try to introduce some challenges which we have in our country due to COVID-19 pandemic. So first of all, I will introduce a little bit about the current situation in Georgia, what we have currently in Georgia. Our population is about 3,900,000. And total cases nowadays, we have more than 250,000. And active cases nowadays, we have 7,000 and total tests more than 2 million and tests per 1 million population, more than 500. Of course, the situation in Georgia was not much different from other parts of the world because the COVID-19 pandemic, it was a big challenge for Georgia as well as for other countries throughout the world. And what challenges were due to immunization service provision? I tried to summarize those challenges on that slides. And of course, this was the shortage of healthcare providers due to illness because about more than 50% of primary healthcare providers have been infected. Also the transportation challenges, which were due to lockdown, and therefore the movement of the citizens were restricted. Public fear of infection because no one knew about this new infection and there was no knowledge about how to treat this infection, how to manage the situation with this. At the early stage of the COVID-19 pandemic, there was insufficient personal protective equipment, also which was a great challenge for the medical personnel and for the patients as well. Lack of knowledge of infection prevention and control measures because the staff needed to be up to date with these infection prevention and control guidelines, which were newly developed in our countries. Also changing healthcare priorities towards visit with COVID-19 and lack of awareness of the people and population that essential services like, for example, including children immunization or well child visits still are available and need to improve on communication channels with patients because I know that not only in our country, but all over the world, the communication channels with the patients were restricted and the patients were very threatened and afraid to go to the primary healthcare centers because they were afraid to be infected. So also what was the PHC response to immunization challenges? Of course, the primary healthcare had to reorganize their business processes, their structure, and we think that it was done successfully. First of all, it was separating symptomatic patients from other patients, and all planned visits were postponed, and the digital health innovations have been established in the primary healthcare centers. So what was the business process reorganizing that? All family doctors were prepared with separate so-called fever area where they have only the patients who had high fever, separate time, or respiratory symptoms as well, separate time for children immunization and chronic patients care. So no one patients we are invited to the polyclinic on primary healthcare center without a telephone triage, and all the patients were triaged by the telephone remotely, and the time for the immunization or, for example, chronic patient care or well child care, it was quite different from the patients which were with the respiratory symptoms, and relook at criteria for house visits as well, because the house visits were connected with highest risk of being infected with COVID-19. Also, the innovative services were established like digital health, virtual clinics, triage and management. online appointments, distance counseling and education of patients, and establishing good partnership with public health services, ambulance system, and fewer so-called COVID clinics. Now you see, from the beginning of the pandemic, here in Georgia, we have established so-called 112 ambulance system. It was the centralized system for COVID-19 patients, and all patients with respiratory symptoms for whom the family doctor suspected COVID-19 were referred for those systems for centralized registry and increased capacity of testing at PHC clinics, because the PHC clinics also have the capacity for PCR or rapid antigen testing, and communication continuity of services and safety of patients and their contacts. So how Georgia overcome these barriers? Also with the support of Ministry of Health and different donors, they have been conducted different trainings of almost more than 1,000 rural doctors, because they needed their knowledge update in immunization services, also well child services, and also in triage of suspected COVID-19. The topics for training were management of suspected COVID-19, delivering distance consultation and triage for the patients, and performing essential medical services at primary healthcare level. Prioritize also certain services like chronic disease care, immunization, child health promotion, preventive services, and innovations also in service delivery, like contacting patients remotely by phone, planning immunization visits using distance communication methods. So if we compare, we have only the preliminary results for comparison of immunization coverage in 2019 and 2020 by specific vaccine during 12 months. But yeah, we will have more specific and precise results in the middle or at the end of February. But even with these interim results, we have the trend that we have average reduction of immunization in more than 12%. And of course, this immunization reduction was due to all of those challenges which I have already listed. So that's it, and that's all. I think what I have to tell to you about the challenges which we have during this pandemic due to immunization. And as for the second question about the COVID-19 vaccination, planned vaccination, and what kind of challenges we are anticipating in the next year due to COVID-19 vaccination, I think that we will continue in the next discussion. Thank you.
Thank you so much, Dr. Neta. That was really great, and you know, highlighted a lot of some similar challenges, I think,
Yes.
faced, and it's quite interesting to see that the move to mobile and which areas you know, are prioritized for the in-person visits versus the virtual visits, and that's quite interesting to hear, and interested to see other colleagues if their countries have done something similar, and you know, where adjustments maybe need to be made in a setup like that in the coming year. I'm going to turn less to Dr. Yuliya Hajayeva from Azerbaijan. Dr. Hajayeva is a professor. I'm sorry, let me, her bio just got lost there, but Dr. Hajayeva is a professor and pediatrician in Azerbaijan, and worked with colleagues for many years in pediatrics. And Dr. Yuliya, I'm interested to hear some of the challenges you have been facing in Azerbaijan this past year, and how some of these challenges are similar to and maybe different than some of your colleagues. So over to you.
Thank you. Yes. Yes, I'm Hadia Boudvia. I'm Associated Professor of Azerbaijan Medical University, and I'm the member of Azerbaijan Pediatric Association. Yes, first of all, I wanted to tell you that as we know that the beginning of 21st century will be remembered the appearance of new types of viral infections such as COVID-19. And that is why it shows that vaccination is very necessary, and the significance of vaccination increases nowadays, because we know that vaccination is the best way in prevention of infectious disease. You see in this slide, I show there the efficiency of vaccination that as a result of immunization annually, let us prevent from 2 to 3 million lethal cases by diphtheria, tetanus, pertussis, and measles. Then preventive vaccination stops the increase in antibiotic resistance. And you see, in our country, we take attention to this vaccination because it is in Azerbaijan, vaccination is priority part of the state health policy. And you see our first vice president has repeatedly taken part herself during this vaccination campaign, and it was socialized, you see. And this vaccinate prevention is a tool for implementing of Azerbaijan demographic policy concept. And our present constitution of Azerbaijan provides supports organizing work with the population in the field of immunization. Now I'll show you our national immunization calendar. You see, during all these years, we hadn't any problems in carrying out of our vaccination. And now in this the next slide, I'll show you the results of this vaccination. That we got good results. You can see our result in this slide. During COVID pandemic, we think that there can be some difficulties, and you see all governmental and non-governmental medical organizations knew about it, and we began all our measures in time. We began enlightenment of parents that it is necessary to carry out our routine vaccination, even if there is so terrible disease as COVID-19. We began explaining it to our parents, explaining efficiency and safety of these vaccines. Then we think that there can be some difficulties, maybe fear to take their babies, maybe. And that is why, beginning from first day, we began explain that they should follow preventive measures and they protect themselves and their children from COVID-19. And that is why it is necessary to continue our routine vaccination. And that is why we get best results. You see, last year we could continue our routine vaccination in our country, and plus, together with this routine vaccination, in the beginning of 1990, in our country, there were carried out vaccination against measles. As you know that there were increasing of disease with measles in several countries, and there were some increasing in our country. And there were not any problems to carry out against measles in the beginning of 2020. And in autumn months, we began, together with this routine immunization, we began to carry out against influenza vaccination too. And all these measures help us in this activity, because all these workers, medical workers, activity were very related, and we began everything in time. And that is all about our routine vaccination. And about the second question, I'll answer later. Against the COVID vaccination.
Thank you, Dr. Livia. And maybe I'll stay with you with the second question that I'm going to give to all the panelists about COVID-19 vaccination, because this is you started your slide here. You know, we're starting to look forward here into 2021 with some emergency authorizations already have happened with COVID-19 vaccines. We assume that there will be some, quite a bit of rollout of these vaccines in the region in the coming year. What type of challenges are pediatricians and other health workers anticipating having from this rollout, and it seems very much that you have already blended in this approach to COVID-19 vaccines with the conversations on routine immunization, but just maybe say a little bit more about how you're anticipating addressing these challenges in the coming year.
About COVID-19 vaccination. You see, nearly, yes, I told that when pandemic began and these infections spread all over the world, we joined to this problem, to this vaccination, routine vaccination. And you see, I told that we began all these measures in time. But we all know that only vaccination against COVID will help us to win this infection. And nearly a week ago, in our country, we began to carry out vaccination against COVID-19. You see, you can see in this scheme that there are several stages. During first stage, we are going to vaccinate health workers, then persons over 65 years age, and law enforcement agency staff who involved anti-epidemic measures. And now I told that nearly 1 week ago we began this vaccination. And you see, first of all, this vaccination joined our medical workers, all doctors, nurses, and the role of social medical work politicians in vaccination against 19. We think, first of all these workers, politicians, social medical workers, must activity relatedly they can be do it, as in our country, you see. Then you see, when the vaccination process of political and medical leaders should be socialized, because it will be very very useful. And this, first of all, our health minister and head of Tabib were vaccinated. Then our rector of medical university was vaccinated. And now we have very good trend. Prominent scientists, doctors, prominent workers of medicine joined to this process, to vaccination against COVID-19, and they try to socialize it by Facebook, by Instagram, and you see it gives very good results, because now there are information from our members of pediatric associations that from regions, people's attitude of the population to this vaccination is very good, and they joined this vaccination process with great pleasure, you see. And we think enlightenment of population and socializing this vaccination will help in us in future. It is only several days we began, and I hope it will help us to win this infection. And I must tell that several days ago, our country was included in the list of countries, successful countries, yes, fighting with COVID-19, maybe as a result of these measures.
Thank you so much. That was really great. And Dr. Marine, maybe you could pick up on this. I'm sorry that I stopped you earlier. Maybe just to say a little bit about what you anticipate coming in the coming year on COVID-19 vaccine challenges that you may have in Armenia. Dr. Marine, I think you're muted.
Well, I want to present you about the vaccine, what we have done. Our Ministry of Health has also signed an agreement with the COVAX facility in order to procure a vaccine against COVID-19. And also, Ministry of Health is negotiating with other manufacturers about this vaccine. But the main thing that we need to have is that we, among our population, we have many concerns about this vaccine, about safety and efficacy of this vaccine. So, first of all, we think that we will have, with the help of COVAX facility, AstraZeneca vaccine, and we need some evidence-based information about safety and efficacy of this vaccine. Also, our NITAG has a meeting, and during this meeting, they discussed about the groups that will be vaccinated first of all. And such as we don't have enough amount of vaccine, they decided to do by phases. And during the first phase, they recommended to do the risk groups that are the medical workers, elders, patients with chronic diseases, and also medical workers. And if we will have enough vaccine, we shall pass to the second phase. Then we shall also vaccinate other groups. So the main challenge that we have is to have evidence-based information about the efficacy and safety of this vaccine.
Thank you, Dr. Marine. And yes, I think that is quite a challenge we're seeing, with multiple vaccine candidates coming out, uncertainty over the amount of supply, the vaccine candidates having different, platforms of delivery. There's, I think, a lot of that need and of questions, how to answer those basic questions. The Saving Vaccine Institute, our immunizationadvocates.org site has some resources for health workers to kind of help, and some good places that have some of that information in a condensed format to help with that. But we know that this is going to be an ongoing challenge for health workers to navigate that material themselves, as well as now help their patients navigate as well. And so, Dr. Nato, a final comment to you as to this topic in Georgia and what you're anticipating, and especially at the primary care level, you know, how you are looking at approaching it. I think you're on mute.
I will share again, sorry, thank you so much. I will share again my screen about the challenges which we might anticipate in the coming year for that COVID-19 vaccine. So, as we already know, so there are some challenges which might be a little bit different based on different countries, but most of those challenges are common throughout the world. So what kind of challenges we are anticipating in the coming year? So our government has already developed the strategic plan of COVID-19 vaccination. You know, Georgia is the part of the COVAX platform, and we have the negotiation process with this COVAX platform for importing the vaccine in nearest month. And we think that in March, we will have already the vaccines. And the main term, which should just consequence the vaccine, is that this vaccine should apply to the criteria of WHO authorization. So these vaccines might be the Pfizer vaccine, mRNA vaccine, or the Moderna vaccine, or maybe AstraZeneca vaccine. So what kind of challenges we are anticipating in the coming year? That with the introduction of the COVID vaccine, the country's main focus and resources will be shifted in this direction, which may threaten the routine immunization of children, because we have very ambitious aim of vaccination coverage. With COVID-19 vaccine, we are going to cover almost 60% of the population. Of course, this will be step by step, because at the first step, the main priority of the vaccination should be the elderly people, the healthcare worker, but then we are moving through other populations as well. In case of worsening situation with COVID-19, in case of, for example, the third wave of COVID-19 and etc., there is a risk of continuous lockdown, which will be obstacle for routine immunization due to restricted movement of citizens. Shortage of adequate infection prevention and control measures at all fixed sites, because we have a lot of rural areas in Georgia where we are not sure that at all fixed sites there are all infection prevention and control measures, including designated waiting areas, patient flow patterns to minimize the contact with healthcare workers and vaccinators. Also, we are sure that public health and political leaders can help primary healthcare responding to these challenges, because they have a really very important role in communication with patients, communicate and distribute context-specific some written guidelines and job aids to support the health workers in delivering immunization service safely. Also sensitize communities using popular and culturally acceptable media strategies on the availability of essential services, that immunization is still continuing with location and schedules. Developing also comprehensive, well-designed strategic plan for COVID-19 vaccination, which should not interfere with the routine immunization of children, because this strategic plan, which we have already for COVID-19 vaccination, is, as I have already mentioned, very ambitious, and it will involve a lot of resources, because all PHC centers will be designated for that aim. Also, there should be organized and arranged specific centers for the regional centers, and also some mobile teams should be arranged for the reaching of those populations who are most vulnerable and who have no possibility to be transported to the PHC centers for receiving COVID-19 vaccination. So all of these reasons are the challenges which should be overcome by that. Public health and political leaders might play a big role in helping to respond to these challenges. Like, for example, during the communication of risk mitigation strategies, which are adopted for service deliveries like physical distancing, individual protection equipment, new patient flow patterns, with communities to gain confidence from them that the vaccination process is safe and they would not be infected by COVID-19 if they go to the primary healthcare centers, creating safe spaces where some community members can honestly and freely discuss their mistrust toward public health and immunization systems, because as throughout the world, in our country isn't the exception. Of course, in our country also persists the anti-vaxxers who do not believe to the vaccination, or who do believe in some mistrusted disinformation, which is widespread among the world. So these challenges should be addressed as well, and engage communities, some religious or other influential leaders to promote vaccination uptake. For example, in Georgia, religious leaders also have their opinion, and they could be a good role and example for population in case of uptaking vaccination. For example, our NCDC on TV that he will be example of vaccination. He will show to other population also the example of vaccination, to be vaccinated first by the vaccine. So I think that these political leaders and public health resources might be very useful in order to uptake and to reach the highest coverage of COVID-19 vaccination. And it is also very important not to interfere between COVID-19 and child immunization, in order to cover child immunization as well as COVID-19. So I think that's it, what I have to tell to you. So I will stop sharing my slides. And thank you.
So much, Dr. Neta, and thank you to each one of our panelists for some really fascinating information. I think that that there's quite the challenge for those who are providing vaccines and immunization this year, and of course, pediatricians, family health practitioners, nurses, midwives, others who are regularly interacting with patients on vaccines and immunizations. I think we'll have a lot to share with other health workers who maybe be working on COVID-19 vaccination pieces this year that may not normally do that. And so we're going to start answering a few questions now. I appreciate how active that the chat has been and the Q&A has been. If you haven't opened up the Q&A, there are several questions that have been asked already, and Dr. Leila, thank you for answering many of them. And as folks type in additional questions, I'm going to turn it to a response to the panel for Dr. Barbara Stillwell, who is the Executive Director of Nursing Now. Nursing Now is a global campaign of nurses, by nurses around the world, that is really from grassroots organizations around the world to highlight issues that nurses are facing, to advocate for nurses, and advocate for nursing practice and around the world. So Barbara, I know that you hear from nurses all around the world on the myriad challenges they faced this year as the cadre that delivers more health services than any. So just listening to colleagues today, just wondering your perspective and your thoughts as to how we take some of what has been happening this year and what we anticipate this coming year to really build a stronger recovery for our patients and the world. So over to you, Barbara.
Thank you so much, Vince, and greetings, everybody. What a year this has been, and I think as a world, we are united in finding creative ways of meeting the challenges that all of us have had, and certainly in our campaign, course, last year was the year of the nurse and the midwife, but actually it turned out to be the year of COVID-19, didn't it? And we fought to get some airtime for nurses and midwives around the world, even as they were being applauded, you know, for all the work, quite rightly, all the work that they did. But I think now, and listening to all of you, I think what we say in England, I think probably applies to you as well, which is that what COVID has done is highlighted where the weaknesses are in the health systems around the world, and certainly it has in ours. And so the focus is on how can we build back better? How can we start rebuilding in a way that meets the challenges that we have all seen in trying to respond to the need for a surge capacity in the health system, because there was no time, was there? The pandemic was upon us. We had to continue doing what we'd always done, but nobody gave us any more health workers or more equipment or more PPE or more supplies of anything. So there we were, you know, in a real emergency situation, not really being well prepared to plan. And so I think, listening to all of you, I think there are lessons we can all learn, certainly across Europe, from your experiences too. And there are three that I am highlighting because they've really shone out to me. The first one is about information. So when we first became an internet age, you know, I'm of a very great age, so, you know, I go back to the time before there was any internet. So I can remember a friend of mine who was kind of a communications officer saying, information wants to be free. Information wants to be free. And indeed it does. You can get information about everything now. Just look it up. There it is. However, information also needs to be moderated sometimes, doesn't it? For people to hear what's scientific and true. And the anti-vaxxers are one example of people who have an opinion, and they can feed that by other people with the same opinion that they can access on the web. So I think to ask ourselves, what is the role of health workers? Whose role is it to be talking with communities about true information, scientifically evidence-based information that will help people to make good decisions? And in Georgia, there was a great example of community leaders, influential people. Here in the UK, we have soccer players who are very influential, and they're giving messages about protection and hands, face, space, all of those preventive measures. So going forward, thinking about how we not only make information available, but make it understandable for people so they can use it and make sure people have access to what's true and evidence-based. And sometimes that's to do with risk, isn't it? I never thought that the entire population of England would know what the R number is, but we do. The rate of reproduction of a virus. Everybody talking about it because it's always on the news. What's the R number? And that's good because people understand that if the R number is above 1, then the epidemic is growing. So understanding how to explain risk and make it so people really get it, I think is very important going forward, and will help with vaccination. Because risk is the reason we have our kids vaccinated, isn't it? Because otherwise there's a bigger risk of them dying from some of those diseases. And of course, when you don't see them, thank God, you forget. So getting that risk across, I think, and what vaccines do is critical. So that's the first thing, all about information. The second thing is about health workers. This year is the year of the health and care worker. And the reason it is because we don't have enough health workers anywhere in the world, and we don't in Europe. In Europe, the particular problems are the health workers are aging, and in many countries, imbalance is a problem between nurses and doctors. So in some countries, they have 4 or 5 nurses for every doctor. In other countries, 1 to 1. And so we have to start thinking very differently about what our workforce looks like and who we're recruiting into it. In medicine, there are many more specialists in some countries than there are GPs, and yet all of you have highlighted the importance of primary health care. So how do we get GPs into the workforce? How do we take account of the fact there are many more women now in the health workforce, and women do have different working patterns from men? How do we look at that honestly and accommodate what's going to be needed in the future? One thing for sure, we need to have enough health workers to have a surge capacity for situations like this. How do we do that? How do we make sure we can quickly scale up the health workforce? In England, we've brought back people out of retirement, and you might have done that too. And we've also used final year students to increase the workforce. But it's going to be critical. And we're already being told that this is not going to be the last pandemic. How do we make sure, we can meet those challenges going forwards? Workforce, having an adequate workforce is all about planning. So what are the plans? What are your workforce plans? How much say do you have into those plans? How much lobbying do you do? How often are you invited to be at those top decision-making tables when they're talking about planning the workforce? Do you know how many health workers you have in your country? Where's the health workforce accounts? Who's keeping those up to date? These are all things all of us need to be asking as we move forward. So that's the second thing, the health workforce, absolutely critical, and you've all highlighted that. The third thing is perhaps the most difficult. It's all about seamless teamwork. And this is where the training modules are so important. We need to really take a long, hard look at the skills mix we have in our workforce. And we need to look at it from the point of view of efficiency. So in the UK, now they've trained up all kinds of people to give injections, the vaccine, in fact. So they've brought in so many volunteers. They've got pharmacists doing infections. They've got people who were first aiders doing injections. They've really mobilized a great big workforce to do this work. And it's creative, but we need to think very rationally about who do we need to do the work, and what sort of education do they need. And, thinking in the future about building a team is really important, because we do have a lot of digital tools that help with teamwork. This webinar would probably never have taken place before the pandemic. And here we all are on Zoom. I would never have met you sitting here in my study in England. I would never have met you. But here I am. And, it's wonderful that we can see how connected we can be. And that's true internationally, where we can share our lessons, our experience, our successful stories. It's also true within our countries, where we can be connected in most places almost instantly. So if I, as a nurse practitioner, see a problem I don't understand, I can get in touch with somebody who's close by and say, I don't know what's going on here. Can I tune you into this consultation? We have so many tools at our disposal to enhance teamwork between us. And this is a great moment for us to think about, how do we work together? The slogan for WHO is this year, it's protect, invest, together. And that's a great thing to think about, you know, protect each other, invest in all of us, and make our voices heard together. So those are the three things I've taken away from this. It's been a very rich discussion, and I want to thank you all for all your sharing. I've got a lot out of it myself, and thank you for the privilege.
Thank you so much, Barbara. Really great comments. And you know, and I apologize we don't have as much time to get to all the questions, but I think a lot of the questions were within that scope of. There were a lot of questions on some of the specifics of vaccines and some of the individual patient interactions. And so your point on how we can continue to connect and communicate with each other and share experiences across cadres of health workforce teams across regions, I think will be really helpful and critical, especially in this age coming this year with the COVID vaccines. And so with that, I want to move over to our closing remarks from Dr. Enver Hasangolu, who's president-elect of the International Pediatric Association. Dr. Enver, just curious to your thoughts today, and especially how we kind of move forward with the Vaccine Trust Project and working with colleagues on this topic.
Thank you, Mr. Vince Lesser. Good afternoon, good evening, good morning, good day. Since last year, after COVID-19 pandemic, IPA is dealing with this disaster with WHO, UNICEF, by holding such meetings and webinars and collaborating with local societies to encourage the health worker in this region. The number of affected people overall the world is about 100 million now, and it is increasing. And the number of deaths is about 2 million. And 10% of this figure is belong to health workers. It means about 90,000 affected health workers are within us. And the number of lost death is about 7,000 and unfortunately, the majority affected health worker is within nurses. The most lost is seen in United States, about 3,000, and then United Kingdom and Brazil. The governments and policy makers should appreciate and value the health workers' work, and they're fighting in the front line against this pandemic. Holding such meetings and webinars is very useful for sharing our knowledge and experiences. And if I come to normal or routine vaccination, IPA is saying that continue to routine vaccination. In my country, in Turkey, there is no decline in routine vaccination because our minister told to continue on the routine vaccination. Holding such a meetings is so important as we are sharing and exchanging our knowledge and experience. I would like to thank all of you for participating in this meeting, and my sincere thanks to my friend Leila Namazova for coordinating this meeting in this area of the world. And my thanks to Nevin Tucker who began to organize these meetings and webinars with IPA. And of course, my thanks to SABIN Vaccine Institution. And I hope we continue to these meetings. Thank you very much. And thank you. Good evening, good day, good morning.
Thank you very much, Dr. Enver, and extending my thanks to the International Pediatric Association. It's been a really great partnership with them that we're just getting started with, and to that end, we're going to close today with Caitlin Christensen, the Vice President for Vaccine Acceptance and Demand at the SABIN Vaccine Institute, and Caitlin is going to close us out by just reminding us of some of the actions that we can take together going forward. And Caitlin, over to you for some closing comments.
Great. Well, let me add my thanks to all of the excellent speakers today. And my thanks to IPA for the excellent collaboration, but most of all, thanks to all of you who joined today and who are working every day to help improve the lives of children and adults in the countries in which you work. I think the conversation today, it's been clear that COVID-19 has had a major impact on routine immunization, and it's been inspiring to hear about many of the innovations which you all are deploying or considering to address some of the challenges that have emerged. But as countries turn to preparing for or the actual introduction of COVID-19 vaccines, I was very struck by hearing lots of conversation today about needing to discuss risk, needing to address hesitancy. And so we want to share with you some tools and resources because strong communications and advocacy will be critical in this next period. Some of these resources have been shared through the Zoom chat today, so you can register for the Vaccine Trust Project course to help with some training on stronger communications and stronger advocacy. And there are some additional resources at SABIN's website, which my colleague Vince mentioned, both in English and Russian. And we want to remind you of some key days that are coming up that will be key moments for advocacy in April and that are well timed with probably rollout of a COVID-19 vaccine. And lastly, you can be in touch with us to share your stories of advocacy, to share your testimonials by video of how you support immunization. Following the webinar today, we hope that you'll feel free to reach out to either my colleagues at IPA or to those of us at the SABIN Vaccine Institute with any questions or any feedback on any of the resources we've shared today. And again, let me thank you all for joining, for spending some time with us this morning, this afternoon, this evening, and I'll wish you a pleasant rest of your day.
Thank you, Caitlin. And just to reiterate my thanks to everybody, please do continue to contact both IPA, go to that site, get enrolled in the course. Please indicate to them in an email your interest if you would like to participate in some of these advocacy and communications efforts. And sharing your story, we would love to have, there's going to be many different ways. Barbara highlighted that the World Health Organization has declared this year the year of the health worker and care worker. Obviously, vaccines and immunization are going to be a prime topic throughout the year. But we need to have the voices of frontline health workers be prominent in those discussions. So please do reach out to us. Please do share your ideas and your feedback on ways that we could better support and enhance your efforts. And we thank all of you and so much for all the hard work that you're doing, and look forward to continuing the discussion going forward. Have a good evening, everybody. Thank you so much.